respect your time, who been on time to attend, so let's just go ahead. My name is David McMahon. I'm the founder and CEO of OcuSci. And today we're going to talk about atraumatic meibomian gland expression in clinic without disposables. It's a unique feature of our system. And we're going to hear from Paul Karpecki, who gave a very excellent webinar for us a couple of months ago. So I've edited and selected some of that presentation. And then also Jerry Robben, who's the chief optometrist for Bowden Eye, a group that's been historically, early adopters of technology and really kind of in the forefront of dry eye treatment. And Jerry did an excellent case study for us. So, so OcuSci was founded in 2011. So we've been in dry eye for 14 years. We're still kind of a boutique company, if you will, but we're in about 500 clinics, 15 countries, and growing pretty rapidly. We're a big believer in studies. So the MGrx we're going to talk about today, we already have 3 published studies and 2 more that are in the works. So we look forward to that, and I will review those studies today. So I'm not only the founder, but I'm also a patient. Those are actually my glands. As of the last scan I had at the Australian optometric national meeting a couple of weeks ago, I have 50% gland dropout in my bottom lids. So I definitely use my lid scrub, our omega-3 supplements, and compress when I can. And I definitely get an MGrx treatment every 6 months or so whenever I can get a doc to treat me when I'm out in a clinic. So I do use all of these products and need them as well. So OcuSci, a couple things makes us unique. We're really the only company that's solely focused on dry eye. And we're the only company that has everything from in-clinic, meibomian gland treatment to meibography to lid scrub to supplements and the world's best dry eye compresses as well. So we really have everything that you would need in clinic and home care to treat your patients and really have success with dry eye treatment, which is not that easy to do, as you know. It really takes a multi-attack approach, if you will. And you'll notice that Paul Karpecki and Jerry Robben and others who really have spent years doing this, make that point over and over again, that it's not just one tool, it's a combination. So to talk about the MGrx, MGrx came out last year, so it's still relatively new, about a year in the market, a little more than that now. It's the only triple modality system for treating dry eye. There are no disposables, no per patient click fees, if you will. And when we talk about atraumatic expression, I think this is something you're going to see a lot more of in terms of discussion. I know that in the DEWS 2, and I haven't read the DEWS 3 yet, but imagine there's quite a bit of discussion in there around not using excessive force on meibomian glands. There have been multiple studies looking at histology and other things, a lot of in animal models, but still using metal expressors on meibum that's not properly melted and lids that aren't properly heated requires a lot of pressure. And those handheld, expressors can go up to 45 psi. And there's a lot of concern that that is actually damaging glands, especially glands that aren't in great shape, right? So the MGrx, one of the things we did is really limit the pressure on the expression instrument to 12 psi. So it's enough pressure to get the job done, but does not cause pain, does not put excessive pressure on those glands. And to me, this is kind of a long time coming. I actually worked in cardiovascular and general surgery many, many years ago. And, in cardiovascular surgery, they do not use metal clamps. They haven't for 40 years. So they are already aware of the damage that can be caused to tissue by putting straight metal clamps onto tissue and applying a lot of force. So general surgery, cardiovascular surgery, they're using padded clamps to protect that tissue. So again, triple modality for MGD. I'm going to take you through that as well as Dr. Karpecki. 0 to 12 minutes of clinician time. We say that because your tech, depending on what state you're in and the skill level of your techs, about a third of our docs have their techs doing this treatment, and then others are doing it themselves. Obviously, it's a big point of focus, and it's a great time to spend some quality time and get some really good results with your patients. So some docs do choose to do it themselves. Based on the fact we have no disposables and no per patient cost, the ROI on this device is 40 patients or less, depending on what you're charging. And it does come with a 4-year warranty, bumper to bumper. So if anything goes wrong, we will take care of the device and replace it. We're based in San Diego, and we're shipping every day here out of San Diego. So let's just look at the 3 steps here. I'm going to go ahead and play this little video that always getting questions about the temperature, so you can see them right there. So the first step is thermal debridement, and Dr. Karpecki is going to go into this in detail, so I won't go too deep on it. But basically, we're trying to decap those glands, remove the biofilm. Very simple. Heated golf club spud, if you will. We invented that. No one's ever had that before, and it just allows you to use less pressure. And this is one of the features that the thought leaders really love with the MGrx is the debridement. Thermal lid massage, obviously we're trying to melt that meibum, get it closer to the orifice, get it melted so that it's easy to express. Built-in timer, so 2 minutes per eye. And then the last step, thermal expression, I already talked about atraumatic expression. But we're using heat at every step here, so there's never a time when you don't have heat on that eyelid. And if you've used warm compresses and tried to express, you know how quickly that lid loses temperature. It's about 1 degree a second. So it's very difficult to do expression without active heat. Very, very difficult. So without further ado, I'm going to have Paul Karpecki take over here, and as I said, we edited this out of his presentation from the last webinar he did for us, and I think Paul needs no introduction. You probably have seen him speak in person. Maybe has more experience with dry eye than anyone. He actually trained under Donald Korb, the doc who invented LipiFlow and did a lot of the base research. So just a wealth of knowledge along with a wealth of experience, a ton of dry eye patients, and just an excellent speaker as well. So I'm going to go ahead and let Paul take this over, and then I'll be coming back in about 7 or 8 minutes.
Cycles we talked about, 29 years ago, I'd say that I didn't get a great response. You got a little improvement because you're never treated the cause, which is the obstructed glands or the blepharitis. You really have to go after the cause when you're treating the inflammation and the tear film. So that brings us to MGrx, because the ability to treat all of those things in one in-office treatment goes far, because now you're giving the patient a boost. Like, even if I was to prescribe something for OBIT, like let's say an early contact lens intolerant patient, which is typically evaporative dry eye, I'd probably do the hydrating compress. There's the O covered. I would do a lid scrub, as David showed on the mask. For the eye, I do an omega fatty acid. That's a great way to control inflammation. And for the tear, you might just use a artificial tear, lipid tear, or something like that to start them off until they're producing their own tear. But it's that simple. But I found if I missed one, I never had really good success. I had to realize I have to treat all 4 things at once. But I could also give them a big boost by something like an MGrx, a trimodal approach where I'm already attacking every single one of those things in one procedure in the office. And I'm a big fan of in-office procedures. I think patients already go and find artificial tears. They've already probably been on a cyclosporin or lifigrast or something along the way. No one's addressed the O and the B. And by doing something in the office, the obstruction, the blepharitis, you often go much further with your success. It's just catching it and removing it, but you are doing some pressure, not to where there's pain. In fact, it's just the opposite. I wouldn't even use anesthetic for that step. The patients will tell me that just at the minute you're finished, the impact it has, just that step alone. It's like, this is the best feeling ever. Running it over the orifices, and you can see the little meibomian gland orifices are opening, so you just run it across there. Massage, 2 minutes is great, because I agree, you're really trying to just push out. You've got the heat already in place. The goal here is just to be able to push that oil in a good way from moving it naturally. And then finally thermal. And I love that this has, so to speak, a governor on it, so you can't hurt the patient. I had a colleague, an ophthalmology colleague I worked with for probably been, I don't know, was that about 14, 15 years ago, 16 years ago now. And he would like be painful to those patients. Like he would squeeze so hard. Look at the oil fringe there. How beautiful that's coming out of that. So hard with these patients. And when I saw them in my clinic years later, all their meibomian glands were gone. I think you can really damage them if you, he was definitely doing 50. He felt like it had to hurt for it to work. He really did. He told patients that. They all told me this. And really, it's the opposite. You want to be under 12. That's the max you can get here. That won't hurt a patient. Typically, unless they have really thick eyelids, then you hold down a little less than that. But what a great expression. Look at all the paste-like expression coming out. And that's really just where you want to be. And you just go right across each time. Don't grab it and move across with it down. Each pressure is individual. And then like that. And it's really easy. It's a great instrument. So well designed. I like the heat on the red side. I thought that was a great development too. And then just each step along the way, you can't press too hard to hurt the patient, and allow it to come up. And I like this as the third step. I think debridement opens everything up. Massage moves things to where you want it to be. And then you don't have to do a lot of pressure here to get it out. But the relief for these patients is pretty significant. The worst thing is a patient who spends a lot of money on IPL and doesn't get the results they want. So anything I can do to hedge the results to enhance the opportunity. I mean, most patients will do okay with it on their own, but there's added huge amount of value to expressing the glands because it doesn't do that aspect. It can't heat it to the same level. So, you know, there's 4 treatments typically for an IPL because I tell patients it's intense, so we have to divide it by 4. And so on the 3rd and the 4th, I want to do something that allows for that expression, like an MGrx, the ability to then get that extra effect they need, enhance what's going on, and then the 4th one for sure. So they're compatible. They work differently. IPL works on the telangiectatic vessels to kind of shrink them down. Helps with kind of the activity of the meibomian glands in terms of their internal functioning from the standpoint of the mitochondrial activity to a degree, but it doesn't do the expression, it doesn't do the debridement, and it doesn't help massage that out. So these are very compatible technologies and enhance the overall results. Length of time to perform, you know, you're looking at about 5 to 10 minutes with everything, prep time, getting the patient set up, going through what's necessary, taking your time doing it. You can certainly do it much quicker. And really, you're looking at just 2 minutes of massage per eye. So there's 4 minutes right there. Expression is usually 1 or 2 minutes. I usually do 1 pass on the lower, 1 on the top, and then maybe 1 more in the nasal to central, the most important glands. So I do 1, 2 on the top, and then 1, 2 at the bottom. That's usually enough for me to get everything covered. And then I do the same thing in the other eye. So hence the 5 to 10 minutes. Could be, I have patients come in every month and they swear by it. They love it. They look forward to it. I have a big group that come in every 6 weeks, but I also have patients who make it 4 to 6 months after 1 treatment. So it's hard to know for each patient, but I would expect on average 1 to 3 months is a good time frame for effectiveness, with some going longer.
Okay. And then how does home care come into that, do you think?
There's the difference. You know, the patients who come back, and I love this because it's kind of like, you know, I know the dentist who sees a patient who doesn't brush all the time or floss, and so they have to do more when they come in at 6 months, and often have to do much more long term in terms of cavities, other things.
Yeah.
And yeah, I let my techs do all these, for sure. It's just a better system. I started doing them, but now it's all technician driven. There's a few patients who still want me to do it because that's where it started, and I'll do that on Fridays.
All right. Well, that was Paul Karpecki, and as I said, did a really great. Sorry about that. Did a great hour-long webinar for us, and we're happy to share that. We haven't posted that anywhere publicly, but we will share it if you contact us and request it. I did want to touch on the home care aspect that Paul mentioned, and you know, as I said, we have everything required for home care, but I did want to just take a couple minutes here on our new Duo, we're going to call it the world's best dry eye compress, and we do believe that. Everything we do here, we study clinically. We want objective evidence for, and for compresses, it's really how much does it increase the eyelid temperature. And the key to the Duo, this is a USB powered compress, and you've all probably seen them or tried them. And honestly, they're not great compared to our microwavable, which is in its fourth generation, which is, you know, how we know how to make such a good compress. We basically combined our excellent microwavable compress that puts out moisture with a USB powered heating element. But we did a couple things. So that adds several things. One, it can take moisture, and in fact, it comes with a spray bottle. So we want you to put moisture on it because moisture is the key to having heat penetrate the tissue and increase blood flow. That's been proven many, many times. Um, and then the next thing that really makes a couple things that make this different, but is the weight. So without gravity, right? So if you've used our microwavable compress weighs 6.5 ounces. It's got those natural mineral beads in it, so that compresses to your eyelids and makes very good contact. That's how the heat is transferred. It's direct contact. So a USB like this one on the right, this weighs an ounce. So you've seen these. They just have a flimsy heating element. It's usually wires and some padding. And that just sits across your nose, doesn't really touch your eyelids, and doesn't do much to increase your eyelid temperature. So you can see here on the left, and I'm going to show you a video, a live video we did of this at Ascaris a couple months ago. We'll increase your eyelid temperature 9 degrees so that it's at that perfect 106, you know, temperature where meibum is liquefied and is able to be manipulated if you're going to do, you know, digital massage. With the USB, and this is typical of most of them, you're only going to get a 3-degree increase. And we've tested quite a few, and that's pretty much what you're going to get. This is equal to what our microwavable can do because of the moisture and because of the weight. So really is a completely different product. The other thing that makes both of our compresses, all this technology is in both of our compresses, is this coating called HydroBlock. So you see that's the front of the compress. You see the steam has been blocked from escaping. So when you heat up our compress in the microwave or USB power, the heat and the moisture is going to be blocked from escaping out the front and pushed back to the patient. So we're really delivering with the microwavable 10 minutes of heat and moisture. And with the USB, in 5 minutes, we can raise eyelid temperature 9 degrees because of all this combination of technologies and features that we have. So let me just show you real quick here what we did at Ascaris live. We were giving a presentation for iPro GPO.
So press for instant moist heat therapy. Easily select time and temperature of therapy.
Yeah. Okay, so I'm gonna take a picture of his lids. They are 36. I'm gonna give it 10 seconds. So right at body temperature, expected kind of
Minutes of increases eyelid temperature by 9 degrees Fahrenheit, reaching the optimal temperature for melted meibum.
okay. So there you go. He was at 108, so actually 10 degrees in 5 minutes.
Dry, tired eyes and all-day comfort. Power of moist therapeutic heat today.
And so that was with the start time, starting the compress from room temperature, 5 minutes total. Heats up to 50 C in there's three selectable temperatures, but 50 C in 1 minute. So you can see many features, antimicrobial embedded in the cover, a 1-year warranty, which we handle. Patient just registers on our website, and if they have any problems, they just contact us directly. So you're out of the picture. Just a superior product that's really going to work well for your patients. And a lot of docs are starting to use this in clinic because we do sell replacement covers. So if you wanted to have just a stock of covers and just use this to warm up lids prior to IPL, or we actually recommend it prior to the MGrx as well. It's not required for getting the clinical results that we get, but it is a nice add for the patient. And if they use it in clinic, they'll probably use it at home. So we encourage you to include this in the treatment, build it into the cost of the treatment, have them go home with it. I think it's a great way to go. Okay, now we're going to have Jerry Robben, who's the chief optometrist of Bowden Eye. You've probably heard of Bowden Eye. They also created and run the Dry Eye University, so they've trained, I'm going to say at least a couple thousand other ODs in different techniques and kind of how to really run a dry eye clinic. I think Jerry's just an excellent speaker. He's got a ton of experience. They see a ton of patients. I know that they are treating, because we just did our survey for 2025, I know that they're treating 40 patients a month with the MGrx. So they're doing really well with it. So we'll have Jerry tell you about that right here. And I think this is an interesting case study. He'll kind of explain, but basically, this is a patient who has had bad dry eye, has had many different treatments, is kind of asymptomatic, but you can see her. I think there's more a case of she's used to it because her tear breakup time, her lipid layers, all those things indicate, pretty severe dry eye. So I'll let Jerry tell you about it.
And dry eye can present even with no symptoms, and that's how it is in her case. Now, again, remember, she's been symptomatic years ago, so she knows what that feels like, and she knows how that affected her on the computer and those sorts of things. So her story is more about maintaining that level of control we've enjoyed for a few years and keeping her ahead of the curve again. So we went over all of her diagnostics that I went with you over with you guys and explained. And again, she's pretty well in tune because she's heard it before. She understands what her LLT is. She understands what her T-button or gland count is. And so again, it's not just symptoms, but it's making sure your patients understand these other vital signs and how they relate to their dry eye situation. And even without symptoms, they may require intervention to keep the dry eye apparatus that we're all given the ability to keep working so that we don't get to the point where they become symptomatic. So again, we're really into preventative and not just wait until there's significant gland loss or wait until there's significant damage. But if we have reduction to the gland function, then that's enough to indicate treatment especially if it's not responding to supportive measures like the warm compresses and the like. So I let her know that it was time for another treatment, but I threw her a curveball and said that I have something different for you. And so I told her I wanted to do the MGrx this time instead of a third LipiFlow treatment. I remember her last LipiFlow was about 3 years ago. And so I let her know that the advantage of it is that I felt like, you know, the results were going to be the same, but the cost was going to be less because of the no need for disposables. Without the disposables, we're able to price it at a different level, and we'll kind of talk about that. And therefore, she can enjoy that little bit of a cost savings to have the same type of treatment and enjoy the same results. And so let's go ahead and see how we did with that, David. Okay, let's see what's next. Oh, yes. So here she is. Go ahead and run it. So the 3 different stages that David was talking about, this is my favorite. The very first time I did this on a patient, I fell in love with this. So this is the heated debridement, and literally you can hear the stuff that you are debriding off, the built up skin cells and the line of marks and everything. You can hear that scrape right off of the lid margin. So you're scraping right along the glands and the lid margin and that mucocutaneous junction where the line of marks is, and debriding all of that off to remove the biofilm, remove any superficial blockages that would be there to limit the ability of the next treatments, the heated expression to work. And so I'm not scraping her palpebral cons. You can kind of see how her lid kind of everts down there. I'm keeping it right on the lid margin. Anything to add there, David?
Yeah, I was just going to ask, is she very supine? Is she really reclined back in the chair?
Yeah, so we have her in our minor procedure room. So she's laying on like a treatment chair. It's not completely laid down, but she is, kind of at a little bit of an inversion, but she's laying back.
Yeah, it looks to me, I always advise that because it looks to me like you've got really good access there to her lid margin.
Yeah, I have one of my students with me running the camera, and so they were, wrapping around and getting a good angle for everybody to see. So
they did a great job. So
yeah, my students love helping me with these presentations.
And let me just to the audience right now, if you have any questions for Jerry or myself, please go ahead and put it in the chat, and we'll try to jump on that at the end here. All right, shall we move to the next slide?
Yes, please. So you can go through this one. This is the debridement. Yeah.
All right, there we go.
So now we've got the heated part, and this is just fairly self-explanatory. Like David said, about a minute and a half per eyelid. You put a little ultrasound gel right on it. Doesn't take much. It's not like you're doing IPL, just a little bit for lubrication factor. And you're just massaging the Meibomian glands. And this is kind of a side view of what I'm doing here. And she told me while we were doing it, and then she even reiterated it at her follow-up. She said that was my favorite part. So she really enjoyed this part of the treatment. And as you would imagine, most people probably would. It's almost like a spa treatment.
We hear that every time.
Yeah. And so it's true to form. This stuff it all makes sense once you start employing it. So that's simple. I'm doing that to all 4 lids, and then switch to the expressor. Like David said, the red side, that's why it's color coded, is the heated side, and the blue is not. And so therefore the blue goes on the inside to protect the globe and the cornea. And you're just pressing across there. And you can kind of see some of the meibum start to come out. She doesn't have like toothpaste coming out or anything like that. Again, all we're doing is just reopening those glands that I've done before with LipiFlow, but this time doing it with the MGrx to, do the same quality of work at a lesser cost, and maybe even less kind of pomp and circumstance with all the plugging in this and sticking these things in the eye. This is just so easy to do and quick, and it's second nature really, because it is similar to a lot of the other dry eye treatments that have been around that are similar. But again, it has the advantages that we've stated. No disposables and the 3-in-1. So, we use traditionally like a Blefx and combine it with the LipiFlow, or a Blefx with the iLux. And so again, this multiple pieces of equipment and disposables for each, and using this and then turning that off and and this is all one, it's all streamlined. It walks you through the treatment, so that literally when you're done with one part of it, you hit the button on the controller, and it's ready to take off that utensil and put the new one on, and hit the button again, and it's ready to do that treatment. So literally that's where, we'll talk about techs, but a tech can do this if that's what you want them to do and you're able to. So here we go. Generally, when I do a follow-up, I ask patients to come back in about 6 or 8 weeks. And so this is an 8-week follow-up for her. She noted, stable symptoms. Well, remember, she was a speed score 0. So she's doing this to be proactive. She's doing this to stay on top of it. And again, I'm able to show her all the diagnostics and compare them with how she was 6 months ago, a year ago, and show her that things are starting to change. It's better to get back on it earlier so that we can have a longer time of maintaining that control. And so if anything, she noted that maybe her vision's just a little bit better, as you would expect, with improved tear film quality. And so here's a list of her vitals. Speed score is still a 0. Her osmolarity is a little bit improved. Happy to hear that. Happy to see that. And then here's where it kind of gets fun. So the lipid layer thickness is up at 98 and 100. And if you know anything about the LipiView, that the 100 is as high as it goes, right? So just as a review, she was 57 and 76. Now she's 98 and 100. So that's a direct measurement of the lipid layer thickness. So literally measuring how thick of a lipid layer she has on her tear film. So that's pretty good. Her tear breakup time went to a 14 and a 16. She was at a 4 and an 8. So again, major win there. That's going to help with that continued computer use and anything else, just being alive today, having that tear breakup time on there. And it's going to help with her Meibo. As you recall from the very beginning, I have her on Meibo. And that's just, the way Meibo works. It sets itself within the lipid layer, and partially in the lipid layer and partially in the air. And having more Meibom available is going to help maximize the benefit of the Meibo. So again, Meibo is awesome. We were involved in the clinical trials, but it only works if there's some Meibom in there. And so we still need to do these treatments to increase the natural Meibom in order to keep these pharmaceutical agents working as well as they can. Her gland expression went up as well. Her MGE was a 12 and a 14. Prior to that was 5 and 7. And then her gland count went up to a much more healthy, nearly normal number of 22 in the right eye, 21, and up to a grade almost 2 to 3 where she was grade 2 before. All right, David, we can see the next slide. And dry eye.
So just to summarize on Jerry, and again, there's a full webinar from Jerry as well, but I just did want to hit these highlights again. Lipid layer is pretty significant, right? It's a doubling of the lipid layer. Tear breakup time reflects what we've seen in studies, a doubling and tripling of tear breakup time. And then also just the patency of the glands and the number of glands that are working. So this is really what we expect, and patients feel it the same day. So this isn't, 3 weeks later. This is the results that patients are feeling from the day they get this treatment. So just a few slides left here. I did want to cover our published clinical studies. This is our first study. And and these are all clinically, statistically significant data. So 40% improvement in speed score. It's a 30-day follow-up. Keep in mind that was a 2-month follow-up with that Jerry Robben just presented. And a 145%, so tripling into your breakup time. So that's kind of what he saw in the one eye and a doubling in the other. And then a 300% improvement in Meibomian gland score. So that's the difference of 3 or 4 glands working to 12. And that's the difference of some of the comments we got from patients in this study was, now I can wear my contacts again, for 6 hours a day or 8 hours a day. I mean, that's life-changing stuff. So this really are tremendous results, and this is what we expect. And all patients showed improvement. So that's, again, this is something you feel confident about, that your patient is going to benefit from one treatment. This is another study that was presented at ARVO this year, actually, and this is part of a larger study that is still underway. So 4 to 6 weeks after therapy, 51% improvement in OSDI score. So even bigger improvement in OSDI. And again, we expect to see more of that data this year. And then this was published by James Wolfson's team. So if you know, James is the chairman of the TFOS committee. So there are only 6 members of the TFOS, Tear Film Ocular Society. So they put out the dry eye workshop reports. So Paul Karpecki and James are both on that, and both have an MGrx. So James just published this study on the MGrx and got a 34% improvement in OSDI score. And his was also, they looked at 4 and 8 week follow-up. So, and it did maintain as well. So that's the 3 published studies we have thus far, and another 2 are in the works. In terms of, some of, what the owners of MGrx so far, again, it was launched, early last year. So we just completed a survey of the users and owners of the MGrx. And here's what we found. On average, clinics are treating 4 patients a week with the MGrx. The average charge is a question we get a lot across the country, is $370 per treatment. It varies quite a bit from $150 to $800. Just spoke to a doc in Idaho a couple days ago, and they are bringing patients back once the dry eye is diagnosed. They're billing for a medical visit, and they're charging $200 for the visit. So they're getting $270, per patient, and they're treating about 30 patients a month. So it's become first of all, he said he's really happy because he's able to treat a lot more patients than he ever had, and he's getting excellent results. And it's also, basically paying for a tech. So I'd call that a win-win-win, really. In terms of success rate, well, first of all, how many patients, we asked, are you offering it to? So, you see a lot of dry eye patients. How many do you think warrant, this discussion about, I really think you ought to try this treatment? So the answer to that one was 1/3 of the patients that have dry eye that they see they're offering this to. And of those patients, 1/3 of them are actually taking the recommendation and purchasing the treatment. So 1/3, that's a very high percentage, I would say, 1/3 of those that are offered. So, in the discussion I've had with a lot of docs who have IPL, which, as Paul Karpecki pointed out, the MGrx pairs really well with IPL. But IPL, as you know, is relatively expensive. 4 treatments, around $1,200, I think, is kind of the standard across the country. And I don't think you're getting 1/3 of the patients that you offered that technology. I don't think you're getting 1/3 of them to agree to do that. I think it's responses I've heard are more in the maybe 10% on the high side. Maybe you're doing better. I'd love to hear if you want to put in the chat what your success rate is. I'd love to hear that. But the other way I see this really combining with IPL clinics is that this is now the MGrx is being offered as a first line of treatment. So maybe it's a moderate patient whose glands are, starting to fail but aren't terrible at this point. You can get them into an MGrx treatment for, maybe a quarter of the cost of an IPL. It's one treatment, and they'll get really good results from that. So I think that is a really good way to expand the number of patients that are being treated. And if they're really severe, then you want to combine the IPL with that. I think that's becoming very common, and I think it's a really good use of this device. About a third of the docs have their techs performing the treatment. You heard Paul Karpecki say that. He's got 100%. His techs are running that whole thing. And in terms of, how satisfied our owners are, 80% said they would highly recommend the MGrx system to their colleagues. That's tremendous, and we're happy to hear that. We also asked about, patient satisfaction, and about the same percentage felt like this was really helping their patient satisfaction, because now they've got something to offer those dry eye patients that, as we all know, are kind of the number one. It's the number one reason for visiting an eye doctor is dry eye. So now you with the MGrx, you've really got a solution for them. If you'd like to kind of run the numbers for yourself, we built an ROI calculator on our website. So if you just go to ocusi.com and just click on the MGrx page, scroll down, you'll see it's a very simple calculator. You can put in how many patients you see, what would you charge, and what do you think your success rate is going to be, and it'll kind of help you understand what your return on investment is. Typically, it's around 40 patients, so very doable. So now let's talk about the options. This is my last slide. So if you've got any questions, go ahead and put them in the chat. Be happy to answer them. But in terms of how do you get the MGrx into your clinic, there's a couple different ways. Again, because we do have everything, we're a one-stop shop for dry eye products, and they're all excellent. We've got published studies on just about all of our products. And I'd really call them best in class for each category. So if you are doing a pretty good volume in terms of patients and home care products, if you're spending around $1,200 a month currently to stock products, and you want to look at our products and switch over to us, you can get a free MGrx system. It's a heck of a deal, to be honest. It is a 24-month commitment, but you can mix and match products however you see fit every month. We've also have an excellent macular degeneration product. So if you're, a high volume clinic, I don't think this is going to be a stretch at all. Just compresses alone, we have clinics doing this. So that's a really great way to go if you can do that. If not, you just want to purchase the system. We're going to offer $1,000 off the system for the next 3 weeks, basically. So $14,995. Again, one-time purchase. The only additional cost would be 2 years after ownership. Your battery is going to need to be replaced. You're going to have to send it back to us for a battery replacement. We will test the device, make sure it meets factory spec, replace the battery, and you get another 2-year bumper-to-bumper warranty. So that's 2 years, battery treatment and recalibration, another 2 years. So 4 years of bumper-to-bumper. And that's a $1,200 charge 2 years out. So that's going to be your only cost. We do also offer the MeiboView, which is a simple meibography camera that connects to a phone. It's a slick little product. It doesn't do lipid layer and some of the other measurements, but it does take very good meibography. If you're just looking to get a meibography camera, this would certainly do it for you, and it's very affordable. So we can offer you both of those. You're going to save $2,000 off that package. So that would really give you what you need, because you really want to show the patients. I can tell you for myself, until I saw that I had 50% gland dropout. I wasn't that serious about lid scrub in particular, and now I'm religious about my lid scrub. Um, Once you see those empty holes where glands used to live, it really makes an impression. So I'm a huge believer in meibography. I think it's really important to be able to show patients that. Um, Also should add, we do offer 90 days to pay. So you 3 payments, 30, 60, 90 days. We also have contracted with an outside company. If you want to finance the whole thing, you can, make those payments, stretch them out to a couple of years. And they're offering like 4 to 5%. And I think payments are in the, 300 to 500, depending how you want to pay that back. Really, really affordable. Again, you're going to pay for that easily. Two patients a month, you'd cover that. So, and then last but not least, the Duo, we'd love for you to try that. We want to offer you 20% off your first half case, which is just 12 units. I think you're really going to like it, and your patients are going to love it for sure. So that's it. Really appreciate your time. And again, if you have any questions, please put it in the chat. You can reach out to me. My email is dm, David M, at ocusci, ocusci.com. Just shoot me an email. I should have mentioned we do have a 2-week demo program for the MGrx. So we know that, you typically want to get it in your hands and test it out. So we do have a 2-week demo. We do charge $99 for that. We find that unless we charge, sometimes docs don't really pay attention to the 2 weeks. So we learned our lesson there. So $99, we ship it to you. You try it out. If you want to keep it, you get the $99 off your purchase price. If not, you just return it to us, and that's that. Very simple. It's a Zoom in-service. It's that easy. It's a 20-minute in-service. You'll be up and running. So really easy, and yourself or your tech or both, really easy to demo, and a really high success rate with our demos. So again, want to be respectful of your time, so appreciate it, and reach out to us. You can also call us on the phone. We do have live people answer the phone. 888-809-6424 is our phone number.